Gentlemen, if you're waking up multiple times at night, standing at the sink a little longer in the morning because your stream is hesitant, or you're rushing to the restroom during the day and feeling frustrated, listen up. These are not just part of getting old. They're signals from your body, and small, consistent choices each morning can change how you feel across the day. Today, I want to show you one simple breakfast habit, 2 pantry ingredients mixed into a warm drink that many men over 60 have added to their routine and say it made mornings and nights noticeably better. I'm Dr. Julia Morgan, a urologist, and I'll explain why this tiny ritual matters, how it works in plain language, how to make it safely at home, and what results you might realistically expect when you stick with it. If this resonates and you want more straightforward, practical tips for men over 50, subscribe. There's a checklist and links in the description to help you get started. First, a short, clear picture of what's going on inside. Two things account for a lot of prostate-related symptoms we see after age 50: low-grade inflammation and reduced circulation in the pelvic region. Think of your prostate and the nearby tissues as a neighborhood. Inflammation is like smoldering yard waste. Poorly controlled, it keeps the area irritated and makes everything feel tight. Reduced circulation is like narrow roads and slow traffic. Blood flow slows, healing signals and nutrients don't get to where they're needed, and repair takes longer. Together, inflammation plus sluggish circulation create the perfect environment for urgency, weak or hesitant flow, the need to get up at night, and that heaviness in the pelvis many men describe. Now imagine you could clear some of that yard waste and open the roads a little each morning, consistently, so that over time the neighborhood becomes calmer and more functional. There's a narrow window in the morning when your body is especially receptive to small nutritional interventions. On an empty stomach, when circulation is waking up and your digestive system hasn't yet been busy, certain compounds are better absorbed and can begin to work where they're needed. I call this the morning window. It's a prime time to deliver anti-inflammatory and circulation-supporting nutrients in a way that actually gets useful amounts into your system. Here's the simple, evidence-informed approach I want to share: a 2-ingredient morning mix using turmeric and a pinch of black pepper. Turmeric contains curcumin, a compound with anti-inflammatory properties that can help reduce low-grade inflammation in tissues, including around the prostate. Black pepper contains piperine, a natural compound that dramatically improves the absorption of curcumin. In plain terms, turmeric is the active agent that can calm inflammation and support circulation. Black pepper helps your body actually use that turmeric. Studies and traditional use both support that combining curcumin and piperine improves bioavailability, meaning more of the helpful compound gets into your system instead of being lost in digestion. Here's how to make it and how to use it safely. You'll want to prepare it in the morning, before your coffee and before you eat. The basic recipe: 1 teaspoon ground turmeric, about a level teaspoon. A small pinch of freshly ground black pepper, roughly 1/8 teaspoon or less, just enough to taste the pepper. Dissolve both in about 8 to 10 ounces of warm liquid, warm water or warm milk, dairy or plant-based like almond or oat milk. Avoid boiling the liquid, warm is fine. Optional, add a teaspoon of coconut oil or a small drizzle of honey. A little fat helps absorption of curcumin since it's fat-soluble, and honey makes it easier to drink for those sensitive to the flavor. Stir thoroughly and sip slowly while still warm. Timing and routine: drink this first thing on an empty stomach about 15 to 30 minutes before your normal breakfast or coffee. Do this consistently each morning. It takes a minute. It becomes a ritual. A few practical tips on preparation that help. Use freshly ground black pepper rather than pre-ground if possible. It's more flavorful and effective. If the turmeric tastes a bit strong, a splash of warm milk or a teaspoon of coconut oil smooths it out. If you prefer, blend it briefly for a frothy golden milk. Keep the temperature warm, not boiling, to preserve the active compounds. Store your turmeric in a cool, dry place and choose a product from a reputable source. It's important to be realistic about what this mix can do. This is not a miracle cure. It's a supportive, low-cost habit that targets two of the common drivers of prostate symptoms: chronic low-level inflammation and circulation, and many men notice incremental improvements when they are consistent. We'll get to timelines in a moment. Before that, let me share a few brief stories from men I've worked with, or whose experiences reflect what patients commonly report. These are illustrative. They're not guarantees, but they may help you picture how small changes can build into significant relief. Stephen is 66. He was waking 3 to 4 times a night and felt exhausted during the day. He added the turmeric and black pepper mix to his mornings, drank it consistently before breakfast, and within 2 weeks noticed a quieter night. He wasn't completely free of awakenings, but the number went down and the interruptions were shorter. He described it as less urgent, more manageable. By week 3, he reported getting deeper sleep and feeling more rested during the day. Stephen said the change gave him back enough energy to go on morning walks again. Richard is 72 and had a hesitant stream that left him standing at the sink longer than he liked. He started the morning mix and combined it with a short pelvic floor routine his physical therapist had recommended. Within 3 weeks, he noticed the hesitation lessening. He didn't claim a complete fix. His flow wasn't the same as in his 40s, but it became steadier and less frustrating. Richard said the reduced waiting time in the bathroom felt like a small reclaiming of dignity each morning. Marvin, age 61, experienced frequent daytime urgency and sometimes felt like he couldn't get to the restroom fast enough. He began the daily turmeric drink and, importantly, kept a symptom diary. After the first week, he reported a subtle, lighter pelvic feeling, less pressure. By week 2, the number of urgent episodes dropped noticeably. By week 3, those episodes were less intense and easier to ignore. Marvin told me the incremental improvements changed his confidence. He stopped planning activities around the nearest restroom and began saying yes to outings again. Arthur, 69, had already tried several lifestyle adjustments: weight management, limiting fluid intake at night, timing of caffeine, and added this morning mix on top of those habits. He saw small changes within 10 days, shorter nighttime visits to the bathroom, and fewer awakenings. Over a month, Arthur described fewer surprises of sudden urgency during the day. He emphasized consistency. He said when he forgot it for several days, the improvements slowed. These stories illustrate a common pattern: modest but meaningful changes over weeks, not overnight cures. The timeline many men report breaks down roughly like this. In week 1, you may notice a subtle reduction in pelvic pressure or a sense of lightness. In week 2, urgency and daytime frequency may begin to ease. By week 3, benefits often compound: better nighttime sleep, steadier flow, fewer interruptions. Some men notice faster changes, others take longer. Factors like baseline health, medications, diet, and how consistently you take the mix all matter. You should also understand the limits and safety considerations. If your symptoms are new, worsening, or severe, such as blood in the urine, intense pain, or sudden difficulty urinating, you should seek medical evaluation promptly. This morning mix is a supportive measure, not a diagnostic test or substitute for medical care. If you're taking prescription medications, especially blood thinners or drugs with narrow therapeutic windows, check with your physician or pharmacist before starting any supplement, even a kitchen-based one. I'm not telling anyone to stop their medications. Instead, discuss the addition of turmeric in the context of your overall regimen. A few other safety notes. Curcumin and turmeric are generally well tolerated at kitchen-level doses like the recipe I described, but they can cause mild stomach upset in some people, especially when taken on an empty stomach. If you experience persistent digestive discomfort, rash, or any concerning new symptom, stop and consult your provider. If you have gallbladder disease or are planning surgery, mention turmeric to your clinician because it can have mild effects on gallbladder function and bleeding risk in high doses. At the amounts we're discussing, about 1 teaspoon per day, serious side effects are uncommon, but it's always wise to check with your healthcare provider if you have chronic conditions or complex medication regimens. Let's talk briefly about the science, without getting bogged down. Curcumin works primarily by modulating the body's inflammatory pathways. Think of it as a lubricant that helps turn down chronic, low-level inflammation that keeps tissues irritated. Black pepper's piperine inhibits certain digestive processes that would otherwise limit how much curcumin gets into the bloodstream. When combined, absorption of curcumin can be dramatically higher than when turmeric is taken alone. That's why the small pinch of black pepper in the recipe is not just for flavor, it's key to helping your body make use of the turmeric. You might ask, why not take a pill with curcumin already formulated? Some men do, and there are reputable supplements with enhanced absorption. The advantage of the simple morning mix is accessibility, no need for a supplement bottle, and the opportunity to make it part of a ritual. If you prefer a high-quality supplement, discuss it with your provider and look for products that report enhanced bioavailability. But for many, the kitchen mix is an effective, affordable starting point. How to make it fit into your morning without fuss. Keep a small jar of ground turmeric by the kettle. Use a measuring spoon for consistency. Prepare the warm liquid while you're still in your robe. Aim for warm, not boiling. Stir the turmeric and black pepper into the warm liquid until it looks uniform. Add the optional coconut oil or honey if you like. Sip it before you step into the shower or before you make your first cup of coffee. Try to do it around the same time every morning for best results. Consistency matters more than anything else. Now, a few realistic behavioral ideas to increase your chances of sticking with it. Attach the ritual to an existing habit, after brushing your teeth or right after you turn on the kettle. Keep a small sticky note by the kettle that says turmeric for the first 2 weeks until it becomes automatic. Track your symptoms in a simple journal. Morning and night, note number of nighttime awakenings, any episodes of urgency, and how your stream feels in the morning. After 2 weeks, review the diary. These small data points help you see trends rather than expecting instant dramatic change. Let me address a couple of likely questions. First, can it interfere with medications? At kitchen-level doses, interactions are generally minor, but because turmeric can have mild blood-thinning effects at high doses, and because piperine can affect how the body metabolizes certain drugs, it's prudent to check with your clinician if you're on blood thinners, certain diabetes medications, or other drugs. Don't stop your medicines based on what you hear here. Consult your provider first. Second, how long should I try it before I judge whether it's helping? Give it at least 3 weeks at a consistent daily dose before deciding. Many men see gradual improvement in that time frame. If after 3 to 8 weeks you see no benefit, it's reasonable to reassess with your clinician. Symptoms may have a different underlying cause that requires other interventions or testing. Third, are there any diet or lifestyle combinations that amplify the benefits? Yes. General measures that reduce inflammation and improve circulation complement the turmeric mix. Maintaining a healthy weight, regular moderate physical activity, even daily walks, limiting very late-night fluids and excessive caffeine late in the day, and managing chronic conditions like high blood pressure or diabetes all make a difference. Pelvic floor exercises can also help with stream control and urgency. Pairing those with the morning ritual often produces better outcomes than either approach alone. Let me return briefly to how you might measure progress. Keep expectations modest but concrete. Week 1. Note subtle reductions in pressure or the sense of urgency. Week 2. Fewer urgent episodes and perhaps shorter trips to the restroom at night. Week 3. Improved sleep quality and steadier urinary flow for many men. By 4 to 8 weeks, if the pattern is working, the improvements often feel more stable and noticeable in daily life. Less planning around bathrooms, fewer interruptions, quieter nights. Remember, individual responses vary. I want to be clear. If you experience blood in the urine, acute severe pain, sudden inability to pass urine, or a dramatic change in symptoms, seek immediate medical attention. Those are red flags that need prompt evaluation. Also, if you have known prostate cancer or are undergoing cancer treatment, discuss any dietary supplements with your oncology team before starting them. If you'd like to try the mix, here's a quick checklist to make it easy. Measure 1 teaspoon ground turmeric, add a small pinch of black pepper, approximately 1/8 teaspoon, stir into 8 to 10 ounces warm water or warm milk. Optional, add 1 teaspoon coconut oil or a small drizzle of honey. Drink on an empty stomach, 15 to 30 minutes before breakfast or coffee. Repeat daily, track symptoms, and consult your provider about any medication interactions or ongoing concerns. As you begin this routine, think of it as an act of small stewardship, gentle, consistent care for your body that supports function and dignity. Many men tell me that regaining uninterrupted nights or shaving a few seconds off that morning hesitation feels like reclaiming a piece of normal life. These small wins compound. Before I close, one more practical point. Choose a turmeric that looks fresh, bright orange gold, and if you can, buy from a source with good quality control. Avoid mixes labeled as turmeric blends that might have fillers. Freshly ground black pepper is cheap and lasts a long time. Grind it as needed for the best effect. Finally, a short medical reminder. This video is for educational purposes and does not replace individualized medical advice. If your symptoms are new, worsening, or severe, please make an appointment with your healthcare provider. If you are taking prescription medications, especially blood thinners or drugs for chronic conditions, talk with your physician or pharmacist about adding turmeric to your routine before starting. Do not stop or change prescribed medications on the basis of this video. If this message felt useful, subscribe for more practical, science-informed tips for men over 50. I'll share a downloadable checklist in the description with the recipe, timing reminders, and a simple symptom tracker to help you monitor changes over the first month. Small, daily choices matter. For many men after 60, a tiny morning ritual, 1 teaspoon of turmeric with a pinch of black pepper in a warm drink, becomes a steady, low-cost habit that supports reduced inflammation and improved circulation. It won't replace medical care where needed, but it can be a powerful, empowering step toward quieter nights, steadier mornings, and more confident days. If you try it, keep track and talk to your clinician about how it fits into your overall plan. Take care of yourself, one small cup at a time.